So in the role as complex discharge, we often work with people who've got dementia, and these patients quite often lack capacity to make an informed decision about their discharge destination. So we work with them on the ward to try and establish whether they've got capacity by exploring issues about how they would manage at home, what they would do in certain situations. We use our colleagues with that, our therapy colleagues, our nursing colleagues, to gather that information. We then decide with families whether we think they have capacity or not about that decision. And if they have capacity, that's fine. We go along with their decision. You know, people are entitled to make what's called an unwise decision, and we would always support people with that. If they've got capacity. If they don't have capacity, that takes it down a different route under the law. So that takes us to what's called a best interest decision. As case managers, we lead on that. So we would gather patients, you know, their thoughts when they had capacity from their family and their loved ones. We'd meet with the family and loved ones, with a social worker, a nurse, anybody else who's of real importance to that decision, and talk about the risks and benefits to the options that are available, which are quite often going home or going into a residential care, and come up with the answers. It's a long process. It's much more tricky now. We've got COVID because we're trying to do it all remotely, but that's a key thing that we do as case managers.